at the office.
Hi, Jordan.
Jordan, nice to meet you. I know we just met, but I do need to know name and birthday.
Yeah, Jordan Crows, 5/26/96.
Perfect. And what brings you into the office today?
Just looking for a annual checkup physical.
Sure, yeah. How are you feeling overall, just in general?
Feeling really good.
Health's okay? All right. Anything before we get into the physical? You want to go over anything physical, mental, anything that's kind of been going on?
Just, I guess physically, I've had some lower back pain on and off for probably 6 or 7 years now.
Oh, wow. Okay. What have you gotten any like imaging or?
Yeah, I did get I guess it would have been an MRI probably 5 years ago. L4, L5 bulging disc is what they had said.
Okay, so it's mostly lower back then?
Yeah,
okay.
Definitely.
What have you done anything? I mean, you said 6 years. Have you done anything to relieve that pain? Are you currently in pain?
Not currently in pain. About a month ago, I went skiing and that certainly aggravated it, but that's now resolved itself. I've done different things over the years between physical therapy, Pilates, I'm trying to think of what else. I even got steroid injections, which helps, dieting, going to the chiropractor, things like that. So.
Okay. Any like numbness or tingling down the legs, anything that could possibly be neuro related? No, okay. It just kind of stays pretty much in the lower back. It doesn't radiate anywhere up the back. Okay. When you're working out and all of that, did that help, would you say?
I honestly, like I mentioned, going skiing, I mean, that aggravated it, so it's hard to say.
Does sedentary aggravate it as well? Like just sitting at a desk or sitting in a car, for example, does that ever bother it?
I guess like mattresses, there's certain, beds that I've used that will aggravate it.
Yeah.
In terms of, being at a desk, I can't necessarily pinpoint, in the last few years where that's really aggravated it. So.
Yeah. Would you say like it affects your everyday life or?
Not anymore. I mean, there was a time where it was very, it was a nuisance for sure, but not anymore.
Okay, well that's awesome. I'm glad to hear it's getting a little bit better. We'll talk about that more when we get to the musculoskeletal region because I am curious kind of more about that. As far as physicals go, do you know when you had your last physical?
I couldn't tell you.
No. Okay, so it's been a little bit of time. Okay, that's okay. Glad you're here now. Did you get any blood work before you came, or has that also been a little bit of time?
Yeah, that's been a little while.
Okay, so we'll do some of that. It's great to have a baseline blood work. Do you see any specialists like cardiology, pulmonology, anything like that?
No, I do not.
Okay. As far as your vision goes, do you wear glasses or contacts?
I do not wear either. I haven't got it tested in a while, but I don't have any trouble with my vision.
Okay. Do you go to the dentist often for cleanings and x-rays?
Yep.
Okay. Did you go this year or were you able to go?
Yep, about 5 or 6 months ago.
Awesome. Okay. Do you get colonoscopies?
I do not.
No. Okay. We're a little early to do screenings for those, so no worries there. Next thing we're going to go over is just your past medical history. As far as childhood illnesses go, any history of like chickenpox, rubella, strep throat, ear infection?
Chickenpox and strep throat, yeah.
You have both those. Okay. As far as any like chronic illnesses, just with you, any history of like asthma, hypertension, diabetes,
no.
Heart disease? No. As far as medications go, are you on any prescription medications?
Adderall, yes.
Okay.
It's 15 milligrams of the extended release.
Okay. Do you take that every day or?
No, probably a few days a week. Really never on the weekends, just for work as needed.
Okay.
So.
Does it help, would you say? Like, you're able to focus better and all of that with that dosage?
Yep.
Okay, that's awesome. Any over-the-counter, like, vitamins or any herbal supplements that you take?
No.
No? Okay. Any drug allergies?
Amoxicillin, yeah.
Okay, what is the reaction for that?
Just breaking out in hives.
Hives, okay.
Yeah.
Any food allergies or environmental allergies?
Not that I can think of. No.
And then no, like, food intolerances or anything like that? No. Okay. Any recent illnesses you've had?
Just the flu about a month ago.
Oh, okay.
But that's since, feeling back to normal.
Awesome. Did you get your flu vaccine
I
or
did not, no.
Okay. All right. Well, but you're okay now.
Yeah.
I know the flu's been pretty bad this
Yeah,
year,
no, I'm good now.
unfortunately. Okay,
Mhm.
good. Glad to hear that. You said that was about a month ago.
Mhm.
Any surgery history?
Yeah, hemorrhoidectomy. That was about 10 years ago, and then they didn't necessarily go, through the needle or use the needle, but broke both the ulna and radius in my right arm.
Yeah.
So I was under for just about an hour, and they set that. So.
Oh, yeah. Okay. Any issues with either of those, or would you say you're doing
It's
okay?
good.
Great. Any previous hospitalizations in your lifetime?
Mm-mm.
No. Okay. With that, I'm assuming no history of like a blood transfusion or any
No.
serious traumas.
Mm-mm.
All right. Good. Okay. Next thing we're gonna go over is just family history. We'll start with if people are alive or deceased.
Mhm.
Are your parents alive?
Yep.
still?
Both alive.
Okay. Do you have any siblings?
2 siblings, 2 brothers. Yep.
Okay. Both alive as well.
Both alive.
Okay. What about any spouse or partner?
Yes. Yep.
Okay. Alive?
Yes, alive.
Okay. And then grandparents. Are those?
Yeah, yep. Both of my dad's parents, my mom's mom,
Mhm.
and then my dad's grandma, actually. So,
Okay. Oh, wow. You got.
so great grandma.
Wow. Okay. With any of them, I guess we start with your parents.
Mhm.
Any history of like hypertension, cancer, alcoholism, heart disease, diabetes, anything like that?
Yeah, for my parents specifically, hypertension with my dad.
Okay. Do you know when that started for him?
Younger than me, probably in
Oh,
early
wow.
20s.
Okay, well, we'll definitely take a look at your vitals and
Okay.
see if that's something we need to kind of look into. Siblings, anything with them, or your mom?
No, not so much. I guess my little brother, similar thing with the hypertension, but
okay.
I think that would be it. So.
Okay. As far as your grandparents go, any issues with them? I know you mentioned you had a great grandma.
Yeah, my great grandma seems to be in pretty good health. My grandfather, who passed away on my mom's father,
Yeah.
he died of bladder cancer. So.
Oh, okay.
Mhm.
Okay, so that's something we'll definitely want to take note of.
Mhm.
Any other diseases, hypertension, diabetes, cancers with grandparents?
My grandma, again on my mom's side, has
Mhm.
leukemia. So.
Okay, currently.
Yeah,
Okay,
currently.
living with that. Okay.
Yep.
All right, good to know. Next thing that we're going to do is your psychosocial history. Start with diet and nutrition. I'll let you kind of let me know how your diet is. Would
Okay.
you say it's well balanced? How do you normally eat? Would you say?
It's not like I'm, eating a ton of fast food or anything like that. Try to have a balance between fruit and vegetables and
Mhm.
fish and grains and things like that. I don't keep track of it
Yeah.
necessarily,
Yeah.
but I'm conscious of it, I guess.
Yeah. Do you try to eat 3 meals a day, or you can eat smaller meals?
No, usually smaller. Small breakfast,
Okay.
granola bar for lunch, and then dinner's usually much larger. So.
Okay. Are you satisfied with your current weight?
Yeah.
Yeah.
Mhm.
Okay, great. As far as activity and exercise goes, are you able to exercise?
Yeah,
Do you exercise?
more so when it's warmer outside.
Yeah.
Biking and running and just playing sports and stuff with friends.
Mhm.
But yeah, I mean during the winter, basketball and skiing when I can, and still trying to work out here and there. So.
Awesome. Okay, so probably like a couple times a week.
Yeah.
Would you
So-
say
Mhm.
mostly basketball and
Yeah.
skiing?
Mhm.
Okay. Do you ever do like weight training or anything like that?
Yeah, I go in phases. So.
Okay.
Mhm.
Okay. Awesome. Any like other like recreation or hobbies you do, or kind of just?
Yeah, hunting and fishing. I guess again, fishing's more gonna be in the summer,
Yeah.
but yeah, hunting, fishing, skiing, basketball, running, biking. Yeah, so I'm gonna try to.
Awesome. That's great.
Mhm.
All those are great. As far as sleeping goes, I will start with on average, how much sleep would you say you get at night?
Probably 6-ish hours during the week and a normal 8 to 9 during the weekend.
Okay. Are you able to fall asleep okay? And then once you're asleep, no issues with like waking up in the middle of the night or
No.
sleeping? All right, that's awesome. Any alcohol?
Yeah, occasionally, whether it be every other weekend, a few drinks here and there, not really much during the week. So
Maybe like 3 drinks every other weekend?
yeah, something like that.
Okay. Any drug use,
Mhm.
recreational or street?
No.
No, okay. Do you smoke?
No.
Any tobacco use, like e-cigarettes, vaping, any of that?
Nope.
Awesome. Do you drink caffeine?
Yeah, probably 2 cups a day.
2 cups a day? Okay. What do you do for work?
Work in logistics and transportation. Excuse me, but my role is more focused on sales and operations, so I'm not super, it's not like I'm, physically, driving the trucks or anything like that.
Okay, you're working like behind the scenes, it sounds
Yeah,
like.
yeah.
Do you work in desk?
Yeah,
or-
desk, so on the phone and computer a lot during the day, and traveling to different customers and stuff like that at
Okay.
times.
How long have you been at this job?
It's been a little over a year.
Wow, okay,
Yeah.
awesome, good for you.
Thanks.
Do you like it?
Yeah, it's great.
Okay, that's great. So with that, like heavy lifting, exposure, any like chemicals, toxins? No, okay. Do you have health and dental
Mhm.
insurance?
I do.
And then I know you mentioned you have a job. As far as financials go, does that job, do you make enough? Are you comfortable? Do you want to go over anything as far as finances?
No,
go?
we're squared away there.
Good. All right, awesome. What kind of car do you drive?
I drive a truck.
Truck? Perfect. It's a nice, safe vehicle.
Mm-hmm.
As far as kind of like family environment at home, I know you mentioned you have a spouse,
Mhm.
and you said you know children.
No children.
correct? No, okay. Do you feel safe at home?
Yeah. Mm-hmm.
Awesome. Do you live in a city or more of a
Yeah, we live in
rural?
a city, smaller city, but yeah, we live in a city.
Do you have city water? Do you
Yeah,
know?
we do have city water.
And then the environment outside is safe, no issues.
As far as I know.
There. Okay, got it. As far as your sexual health goes, I know you said you have a wife. I do still have to ask, do you have multiple sexual partners? No. Okay. Any history of any sexually transmitted diseases?
No.
Any specific concerns? Any issues as far as sexual function goes? Anything you want to talk about?
Mm-hmm.
No. Okay. And then as far as social support, it sounds like you have a pretty big family. I know you mentioned your friends, your wife. Would you say you have a pretty good support system?
Yeah, all the above, friends, family, parents, siblings, wife, yeah, all the above.
Good, awesome. As far as stress goes, I know sometimes we'll get stressed from work, life,
Mhm.
finances, all that. You probably have some, we all do.
Yeah.
What would you say as far as like coping mechanism? What kind of helps you with those stresses?
Yeah, there's not necessarily a go-to, but whether it's just a nice long drive home from work, that can kind of ease your mind.
Yeah.
Watching a movie, going and working out, playing basketball, some type of competitive physical activity, just kind of normal stuff.
Okay. Would you say doing those relief mechanisms work or?
Yeah, it just takes your mind off stuff for a little bit, so you're not, thinking about work or whatever else is on your mind. So.
Okay, awesome, that's great. Okay, last thing we're gonna do is just gonna go over a whole review of all the systems of your body. Start with just kind of general. Any like unusual weight gain, weakness, fatigue. I know you mentioned you had the flu. Sometimes that'll linger as far as fatigue goes.
No, I think that's
Anything
all cleared up now.
Like
So yeah.
no issues there. Okay. As far as skin goes, when I can see your skin looks great, but any like lumps, sores, dryness, dry patches, changes in color of hair, anything like that. All right, next thing we'll do is your head, ears, nose, and throat. For headache, for head, any headaches, dizziness, lightheadedness, anything like that. Eyes, I know you mentioned no glasses or contacts, but any like, blurry vision,
No.
flashing lights, blurriness.
No,
anything
nothing like that.
Okay. For your ears, any ringing of the ears, loss of hearing, infections, anything like
No,
that?
nothing like that.
For nose, any like frequent colds, nasal stuffiness, sinus issues, nosebleeds, anything like that?
Mm-mm.
For your throat, any like gum or teeth issues, bleeding gums, dentures, dry mouth?
Mm-mm.
No, okay. Next we'll do neck. Any swollen glands, lumps, any stiffness in your neck, pain?
No.
For respiratory, any cough, wheezing, pain when you take a big deep breath,
No.
blood, shortness of breath?
Mm-mm.
Cardiovascular, I know you said like no hypertension or heart disease, but any like swelling of the hands, any just like maybe chest pain you might get, heart murmurs, anything. For GI, any trouble swallowing, nausea, vomiting, diarrhea, abdominal pain. For psychiatric, any like nervousness, mood changes, depression, suicidal thoughts, anything like that. Okay. Neurologic, any like changes in mood, attention disorder, vertigo, dizziness, numbness, loss of sensation, tingling. No. For peripheral vascular, any leg pain, leg cramps, swelling in your legs, anything like that. For hematologic, any anemia, easy bruising, bleeding. For endocrine, any like heat or cold intolerance, excessive thirst, anything like that. For musculoskeletal, I know you mentioned the back pain, so I guess let's kind of talk more about that. So you've done PT before, correct? Do you feel it helps? Is it something you maybe want to do again? What do you think?
Yeah, I don't know. It's hard to pinpoint what may or may not have worked. Feel overall, the last couple of years has been much better. It was the high impact skiing and basketball type of sports that tend to sometimes throw it off. But I guess also, sleeping on the mattress was, certain mattresses for whatever reason would cause that. But yeah, I mean, so it's hard to say if, Pilates and physical therapy or going to the chiropractor or whatever may have helped. I'd like to think so, but
okay. Okay, with kind of where you're at right now, I know you said you have no pain currently. Are you okay with how that is? Is there?
Yeah.
Okay.
I don't have any concerns.
Okay, I guess then beyond the back pain, any like arthritis, any other muscular issues, tendon issues, anything going on anywhere else in the body? No. Okay. Urinary, any like retention, having a hard time peeing, any incontinence, kidney, flank pain in the back, anything like that? Not waking up at night to go to the bathroom multiple times? No. Okay. And then for genital, any like hernias, discharge from the penis, testicular pain, masses, scrotal pain, anything like that? No. And then psychiatric, any like nervousness, depression, memory change? No. Okay. I think that's all I have for you today.
Cool.
Any questions or anything you want to go over before I go?
No, I don't think so. I think you covered it all.
No? All right. Well, it was really nice meeting you, Jordan.
Nice
Okay.
meeting you as
Take
well.
care.